Maprotiline, written in full professional and academic style with in-depth pharmacological and clinical details. Maprotiline, luteomil, complete drug monograph. 1. Generic name, drug class, brand name, drug forms. Generic name, maproline hydrochloride. Chemical class, dibenzobicyclooctadiene derivative. Pharmacologic class, tetracyclic antidepressant TK. Therapeutic class, antidepressant, common brand names, luteomil, discontinued in the US and several other countries. Dosage forms, oral tablets, 25 milligrams, 50 milligrams, 75 milligrams, occasionally compounded oral suspension in some countries. 2. Definition. Maprotiline is a tetracyclic antidepressant that works primarily by inhibiting the reuptake of norepinephrine, to a lesser extent serotonin. It is used for the treatment of depression, particularly where symptoms of anxiety or agitation are also present. It has sedative, anticholinergic, and antihistaminic properties, contributing to both its therapeutic and side effect profiles. Mechanism of action. Maprotiline enhances mood by increasing the concentration of neurotransmitters in the brain. Reuptake inhibition. It selectively inhibits the reuptake of norepinephrine at presynaptic neuronal membranes, leading to increased synaptic availability and prolonged neurotransmission. Minor serotonergic effect. It has weak inhibition of serotonin reuptake compared to tricyclic antidepressants, TCAs. Antagonistic receptor actions. Antihistaminic H1 blockade causes sedation. Anticholinergic, muscarinic blockade causes dry mouth, constipation, etc. Alpha-adrenergic blockade may lead to hypotension. Overall, the drug increases noradrenergic tone in the central nervous system, correcting neurotransmitter imbalance associated with depressive states. Number 4. Pharmacokinetics. Parameter, description, absorption. Well absorbed from the gastrointestinal tract. Bioavailability 60 to 70%. Peak plasma concentration reached in 8 to 12 hours. Distribution. Widely distributed throughout body tissues, crosses the blood-brain barrier and placenta, tolerates 88% protein bound. Metabolism. Hepatic metabolism via demethylation and hydroxylation, CYP-D6 involvement. Active metabolites are formed. Half-life, 43 to 60 hours, may be prolonged in the elderly or hepatic impairment. Excretion. Mainly renal, as metabolites, a small portion is excreted unchanged. Steady state, achieved within 1 to 2 weeks of consistent dosing. 5. Therapeutic uses. Maprotiline is prescribed primarily for depressive disorders, especially where anxiety or agitation coexists. Approved uses: major depressive disorder MDD, reactive or neurotic depression, depressive phase of bipolar disorder with caution, anxiety associated with depression. Off-label uses: rarely, dysthymia, persistent mild depression, panic disorder, chronic neuropathic pain, limited evidence. Number 6. Indications. Endogenous depression, particularly with psychomotor retardation and anxiety. Involutional or reactive depression, depression due to external stress or loss. Depression associated with somatic illness, such as chronic pain conditions. Depressive episodes in the elderly, under careful monitoring due to side effects. Number 7. Contraindications. Maprotiline should not be used in patients with the following conditions. 1. Hypersensitivity to maprotiline or related tricyclic, tetracyclic antidepressants. 2. Recent myocardial infarction, risk of arrhythmia or cardiac complications. 3. Seizure disorders. Maprotiline markedly lowers the seizure threshold. 4. Severe hepatic impairment. 5. Use of MAO inhibitors, MAOIs, within 14 days before or after maprotiline, risk of serotonin syndrome or hypertensive crisis. 6. Angle closure glaucoma. 7. Urinary retention or prostatic hypertrophy, anticholinergic exacerbation. 8. Precautions. Before taking this medicine. General precautions. Inform the physician about any heart disease, liver or kidney problems, seizure history or psychiatric history, mania, bipolar disorder. Suicidal risk. Antidepressants may increase suicidal thoughts in young adults 25 years during the initial treatment period. Pregnancy, category BC, use only if benefits outweigh potential risks. Lactation, excreted in breast milk, may cause sedation or feeding difficulties in infants. Elderly patients, increased risk of confusion, falls, and orthostatic hypotension. Driving operating machinery causes sedation and drowsiness. Avoid such activities. How to use: route oral administration. Timing, usually taken once daily at bedtime to minimize daytime drowsiness. With food, may be taken with or without food. Compliance, take regularly at the same time each day. Do not abruptly discontinue. Taper dose gradually under medical supervision to prevent withdrawal or rebound depression. Number 10, dosing information. Population, initial dose, maintenance dose, maximum dose. Do not abruptly discontinue. Adults, 25 to 50 milligrams once daily, 75 to 150 milligrams per day, single or divided. 225 milligrams per day, elderly or debilitated, 25 milligrams per day. Adjust gradually based on tolerance. Usually DAS 75 milligrams per day. Adolescents, if used, 25 milligrams per day. Increase slowly to 150 milligrams per day. Dose adjustments should be made every 3 to 7 days according to therapeutic response and tolerability. Number 11, missed dose, overdose. Missed dose. Take the missed dose as soon as remembered. If it's nearly time for the next scheduled dose, skip the missed one. Do not double up doses. Overdose symptoms: agitation, restlessness, confusion, hallucinations, tremors or seizures, irregular or rapid heartbeat, arrhythmia, respiratory depression, severe hypotension or coma. Management of overdose: emergency hospitalization, supportive treatment, gastric lavage, activated charcoal, cardiac monitoring, management of seizures with benzodiazepines, and correction of hypotension. Number 12, when to stop or avoid taking. If you develop seizures, severe allergic reaction, or heart rhythm abnormalities, discontinue immediately and seek medical attention. Avoid concurrent use with MAO inhibitors, SSRIs, or other serotonergic drugs without medical advice. Avoid alcohol and CNS depressants, e.g. benzodiazepines, opioids. Do not stop suddenly. Dose reduction should be gradual over 1-2 weeks. Number 13, side effects. Common side effects: drowsiness, fatigue, sedation, dry mouth, constipation, blurred vision, anticholinergic effects. Weight gain, increased appetite, sweating, tremors, orthostatic hypotension, mild confusion, especially in elderly. Serious side effects: seizures, dose-related, cardiac arrhythmias, tachycardia, liver dysfunction, jaundice, elevated liver enzymes, severe allergic reaction, rash, swelling, difficulty breathing. Mania or hypomania in bipolar patients, suicidal ideation, especially early in therapy. 14, vital information monitoring. Before treatment, baseline ECG, liver function tests, LFTs, renal function tests, and seizure history review. During treatment, monitor mood, suicidal thoughts, and vital signs. Avoid alcohol or sedative combinations. Therapeutic effect onset, 1 to 3 weeks. Full effect after 4 to 6 weeks. Therapeutic monitoring, plasma levels may be checked if toxicity or non-response suspected. 15, drug interactions. Drug class, effect, risk, MAO inhibitors, contraindicated, risk of hypertensive crisis, serotonin syndrome. SSRIs, e.g. fluoxetine sertraline, may increase serotonin toxicity and plasma levels of maprotiline. CNS depressants, alcohol, barbiturates, benzodiazepines, additive sedative effects. Anticholinergic agents, antihistamines, antipsychotics. Additive anticholinergic toxicity, dry mouth, constipation, confusion. Anticonvulsants, phenytoin, carbamazepine, induced metabolism, reduced efficacy of maprotiline. Beta blockers and antiarrhythmics, increased cardiac conduction risk. Warfarin may increase anticoagulant effects, monitor INR closely. Summary table, category, details, gels. Drug class, tetracyclic antidepressant. Main action, norepinephrine reuptake inhibition, therapeutic use, depression with anxiety agitation. Major risks, seizures, arrhythmia, sedation. Onset of effect, 1 to 3 weeks. Half-life, 43 to 60 hours. Pregnancy, use if benefit risk. Avoid with MAOIs, alcohol, seizure disorders. Thank you. Have a nice day.